And can you give us more details, Premier, on the plan to vaccinate Selkirk's stay-at-large factories? How many? And again, why didn't you start that earlier after we saw what was happening at Amazon?
Well, first of all, thank you for that, Cynthia. Let me start off with the businesses. You know, and I'm tired of all the politics, municipal, provincial, and federal. We need to work together. And I'm not going to be pointing fingers.
You're tired of all the politics.
The supply of the vaccines weren't there. Now they're there, and they're doing a good job. The federal government, we're getting quite a few vaccines, and we proved it. We have the vaccines. We're able to, vaccinate over 100,000 people yesterday. I don't know the end result today, but we're going to exceed that again today. So we're focusing on those areas now. Since we have vaccines, we're going into the high priority neighborhoods. We're focusing on the companies. We're going into high priority neighborhoods.
Yeah, but still fucking over black people and Indians at every possible chance, and anything you can do to a child. Don't forget that.
So we're really having a targeted approach. You know, we have a two-pronged approach here. This is the plan. The plan is limit mobility to protect our ICUs. The plan to get needles into people's arms. We're going into place of worship. We're going into companies. We're going into neighborhoods, and we're focusing on those neighborhoods. Now, as for the teachers, I understand, with the teachers, if we could go right across the province, which we will once we have more supply, we're focusing to make sure that Toronto and Peel and the special education workers right across the province, the special ed teachers, they're going to get vaccinated. And the other areas, be it Hamilton or Ottawa, they're right behind them. But it really all depends on the volume of vaccines. Keep in mind, for every vaccine we give someone, that's taking it off someone else. Right now,
really?
we have behind us 1,000,005 appointments. Is actually now, I think 128,000 people have booked appointments as of noon today. So that's even out of date. That's how quickly it's moving. So folks, please book a vaccine appointment. It is absolutely critical. Like I mentioned yesterday, ages 60 and older, we had over 1 million people that have not booked a vaccine. I'm going to be as blunt as I can. Your life is in jeopardy if you don't start getting a vaccine, get needles into people's arms. Again, 97% of the people that are dying are 60 years of age and older. And going back to schools, 98.9% of schools are currently open.
What about the
99.8% of students do not have an active case. 99.28% of students have never reported a case of COVID. When it comes to staff, 99.77% of staff do not have an active case, and 98.82% of staff have never reported a case of COVID. These schools are safe. They're one of the safest places. And we're going to make sure they're safe by vaccinating the teachers as well.
Next question. Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead. Hello, Premier. I wanted to ask you, is there a reason why your government has provided so little notice for lockdowns and restrictions that are impacting millions of people? This is further to Cynthia's question. It gives a sense of chaos. It's very frustrating for people. So is there a reason for that?
Well, again, we have the two-pronged plan. We're taking the approach that as we saw the ICU capacity grow, as we saw this variant move, it was different than the experts told me last week, as simple as that. And as it excelled, and we got the call yesterday saying, hey, it's going quicker than expected, you have to be nimble, you have to be quick. I was decisive immediately. I said, start writing the orders immediately. So if I just stand still and just keep with the same plan and just keep doing the same thing, it doesn't cut it with this virus or the variants that are coming in. You see what's happening out in BC with the Brazilian variant, and as it's moving across the country, it's concerning.
Follow-up? Thank you. Your government says that it has increased hospital resources, added field hospitals. Yet we're hearing, as your health minister talked about, surgeries, elective surgeries being canceled, patients being moved around the GTA, maybe farther afield. Why is that?
Pass it over to the Minister of Health.
Well, we have made considerable increases into the number of beds available, knowing that with COVID-19 there would be a large number of hospitalizations. So we've increased the number of beds by 3,100 since last year. We also, even with the budget, put in another 125 million to create another 500 spots. We have been increasing capacity at every hospital that we can, creating as many beds as we can. We also are ready to stand up a mobile hospital at Sunnybrook and are ready to start one in Hamilton as well. But notwithstanding all of these accommodations and the significant capacity that we've built in, the hospitalizations that are happening as a result of these variants are taking over our hospitals. That's why we're having to cancel most surgeries and procedures, many of which have been delayed for a long period of time, and why many patients are having to be transferred from one hospital to another across the province. This is not just a GTA issue. We know that even in Kenora, if they have someone that needs to go to another hospital, they only have 4 intensive care beds. They cannot send anybody to Thunder Bay or to Winnipeg. So this is a situation that is happening across the entire province, and that's why we needed this stay-at-home order in order to be able to get these numbers under control so that we can care for the people who are coming into hospital with COVID, but also people who may be involved in a significant car accident or people who have heart attacks. We need to make sure that we have capacity to care for people that need intensive care, stabilization and care.
Next question.
Your next question comes from Travis Damraj with Global News. Please go ahead.
Hi there.
Hi, Travis.
For Dr. Williams and for everyone. Dr. Williams, last week my colleague John Michael McGrath from TVO asked you point blank if the state of COVID in Ontario amounted to a failure in public policy. You disputed that assertion. My question to you now, amid the backdrop of record ICU numbers, schools closed in the largest city in the province, and rapid variant spread is, do you stand by that assessment? For the Premier, the Minister of Health, and the Solicitor General, do you agree with Dr. Williams that the response from this government has been appropriate and timely, considering the dire circumstances we're all in, and the fact that a third state of emergency is now in place a year after all of this began?
So when you asked the question last week, we said we moved into the so-called shutdown. We took steps to take that into position. As I said, the numbers of cases, and we're not the only jurisdiction, our fellow provinces to the west are facing the same types of issues as we all seek to try and bring this under control. And so I think the policy decisions are timely and at a good pace. We'd always like to be ahead even further if we could see it happening. I think they have to be taken in stride because there's parts of the province that are not affected yet. But as the Minister of Health said, some parts throughout different areas are being impacted at different times in different ways. That's how the variants of concern are presenting themselves. They move very quickly and we have rapid escalation. And so we are moving as quickly as we can to put these other restrictions in place to limit the spread. The vaccinations are moving out as fast as we can to cover most vulnerable populations. So I don't see ECs as a failure or as a total success along the way because we'd have to be preempting that along. Over the weekend, for example, we were in the low 400s with our ICU beds. Our numbers of cases stayed at the same amount, and yet the ICU admissions went up quite rapidly that we didn't see and anticipate. It is because of that situation that we now have to take this step where cases have only gone up slightly over the week, yet the hospitalizations and the ICU admissions have gone up even more rapidly than was anticipated. And this is a crisis situation in our healthcare system that we want to solve before it gets worse. So I think the situation is one of timeliness and responsiveness, and we'll continue to take those
outsmart
steps.
stupid, and you can't outsmart the virus because it doesn't give a fuck.
People know on there what they could be doing. And we said before that you have to be doing everything personally to do your distancing, masking, because in the essence of when you are aware of it, with these variants of concern, the VOCs, if you have them in your area, we're trying to tell you now you need to be very concerned, BVC, and then to be very careful with your behavior and activity when you.
So he's again missing the point. You're acting like, oh, a mutation happened somewhere over there. Now there's two of them.
Can be transmitting. So
the original COVID-19 will still mutate. We know that because it used to be called SARS.
Because we are doing our part by putting the measures in place, but it's very critical that you need to do your part. We all need to do our part in carrying out this step to bring this under control, as all the other provinces are doing at the same time.
Follow-up?
Sure, I guess the Premier and Health Minister and Solicitor General are going to address that. But Premier, I have to push back on the 6 days that you talked about at the beginning of your news conference here. Every single time you're asked about this, you punt to the feds. And we are hearing from doctors on the front lines, about factory workers, rideshare drivers dying of COVID-19 in the hospital, people who are without paid sick leave, and you continue to point to federal benefits.
People that were considered disposable in the first place. Jesus, you guys aren't paying attention at all.
How are these folks expected to do the right thing and take time off when it jeopardizes their ability to feed their families and puts their lives at risk?
I don't know how much money that set of keys is worth.
Travis, we're going to agree to disagree on this. And again, paid sick leave. Rather than everyone, be it yourself or other people in opposition, want to continue preaching about sick days, rather than actually, not doing a disservice to the people they're telling it to, but actually tell them, go to www.canada.ca/COVID-19. There's $750 million there. So if it's so bad,
out of 1.1 billion, there's 750 left.
Have accessed the program already. And by the way, because of the hard work and the great work that all premiers have done, we were able to access 1.1 billion. And again, I want to thank the Prime Minister and the federal government for putting this forward. And by the way, it's not weeks. It's a couple of days. It's anywhere from 3 to 5 days that they were able to get this done. They extended it for 4 weeks. So your argument just doesn't fly. I'm sorry, Travis, but it's not cutting the mustard. Simple as that. There is a program out there. If I put the word Ontario and not put Canada, would you be happy? It's the same taxpayer. We're all paying the same taxes. There's one taxpayer out there. Simple as that.
Next question.
That's something the Fords have said. There's
Your
one
next question
taxpayer.
comes from Rob Ferguson with the Toronto Star. Please go ahead.
Where does the money come from? Same place it always comes from.
Hello, Premier. I want to get into the ICU issue a little bit. You were talking about how fast it's risen, and that's what was the trigger for this. We are hearing that there's going to have to be an indemnification order for doctors who very soon are probably going to have to make life and death decisions on what levels of care people can get. So when is that order coming, or have you done it already?
I'll pass that over to the Minister of Health. Minister of Health, James.
Well, thanks very much, Rob, for the question. We haven't finalized any of that yet because we are really working
Don't do
to
it.
make sure.
You've already got a
we can
bunch of
accommodate the people
fucking
that are
rapist,
in
killer
intensive
fucking
care
doctors.
that,
That's all they need is
may
to
need to be
realize that
transferred.
they're indemnified.
But we
They
want to make
already
sure
aren't
that anyone who comes
responsibly
into
liable.
hospital, either with respect to COVID or for any other reason, can be cared for. There are some emergency protocols that are out there. However, we have not finalized any of that yet. We want to make sure that we put all of our efforts right now into making sure that we can have that capacity. That's the reason for the stay-at-home order. This is the reason why we are really asking people to please follow the public health measures and please get a vaccination when it's your turn.
Follow-up?
All right, thank you. Another thing I don't quite understand is talking about how these ICU levels have all of a sudden taken off more than expected. But I do believe the modeling already said 600 by April 9th, I believe. So that's only a couple of days away. I'm wondering how, Dr. Williams, how you could be surprised, or Premier Ford, how you could be surprised that it took off this fast when you've been hearing warnings from the science table since January or February that these variants were dangerous, highly contagious, and could move very quickly. This just doesn't seem to add up.
Yeah, what about
can you tell me what the actual rate of increase in the last couple of days that you're setting, how much it was and how much more it was than you expected?
So when we had the modeling a week ago, we were looking at the data then. As you said, they were projecting back 3 weeks ago that by now we'd be at 4,900 cases a day, and our ICU numbers would be over 500 or approaching that number. Last week we were at still in the upper 2000s. So we had moved, and with our steps and processes put in place, with our lockdowns in various areas, that number was lower. We were in they thought around the 2 to 3% growth rate, not the 1%. And the concerns. Over the weekend, our case numbers stayed around 3,000, but our ICU numbers went up more rapidly, and not in proportion to the case numbers. And the recent data I've seen said we may be approaching more closer to the 5 and 6% growth rate in the last 2 to 3 days. So that changed fairly drastically since last week. So the rate of growth is increasing, and the hospitalization and ICU admission rate is also increasing. So some things were in sync with the modeling, some have moved out even quicker ahead with the rate of hospitalization. This is still what was projected, and we could do it, but also with the steps that we're trying to take place, we are seeking to keep the numbers down if we could, especially our case numbers. And now today we are over 30,200. We're still below the 4,900 that was anticipated, but that doesn't give us much solace in the fact that we're having a higher percentage going quickly to the hospital, going to the ICUs, and taking up those beds, especially with younger people going into them now at a higher rate and in a more severe case when they're presenting to the hospital than they did before.
Last question.
Your final question comes from Christina Stuckey with CTV News. Please go ahead.
Christina.
Hi, Premier. Thanks for taking my question.
Thank you.
Obviously, a lot of people are wondering how the stay-at-home order is going to be enforced. So the Solicitor General back in January said it was going to be at the discretion of the officer. Really, their powers are limited, that basically people could not be stopped unless there were reasonable grounds to show they were violating rules. But just a suspicion or a hunch wasn't considered enough to stop anyone.
What the fuck
are you talking about? How are you going to get people to comply with this? Because right now, I would say the frustration and the pushback is probably at an all-time high. And does the emergency order give you the authority to
probably makes police are required by law to help you?
So before I pass it to the Solicitor General, I'm pleading with the people of Ontario. Please, for the sake of your loved ones, for yourself, for everyone in Ontario, please just stay at home. That's all we have to do. We did it before, and it worked. It worked when we stayed at home. Everyone knows police officers all over the damn place. Knock on 15 million people's homes. But we're asking for the cooperation. We have the two-prong approach. I didn't tell you the third-prong approach. The third prong is the people of Ontario. You've been great. You've been fantastic so far. Everyone's pitched in. I want to thank the frontline healthcare workers. I want to thank, and I forgot to thank the firefighters yesterday. I thank the EMS paramedics, but the firefighters. So please,
but he won't ensure you have oxygen. Wow.
They're the champions. And I'll pass it over to the Solicitor General.
So as you can appreciate, the enforcement piece of the stay-at-home order is not just about police officers. It's not just about bylaw enforcement officers. It's our labor inspectors that are going into those hotspots, those businesses that have had unfortunate outbreaks. We are putting all efforts into ensuring people know what the rules are, that they don't unduly put themselves at risk by getting together, by congregating with people outside of their family. And yes, at the end of the day, when those rules are broken, there are a number of different enforcement components that are available. But I think the
Premier doesn't understand the concept of at the end of the day, the end of that sentence was you get COVID and die.
To do the right thing.
How many tickets you writing to people that are in ICUs right now? How much money are you going to get out of them?
To be able to vaccinate, if the supplies come in, 40% of Ontario adults. Give your friends, your neighbors, your communities, your business associates that window to stay safe for the next 28 days while we continue the vaccine rollout. Thank you.
And we're going to wrap up now?
We have one more.
Okay, one more.
We'll take your follow-up, Christina.
Okay, great. Sorry, I wasn't hearing anything on my end. Maybe that was my phone. Okay, and I totally appreciate that response. Obviously, you want to have faith in the people of Ontario, and there's certainly a lot of people who have been confined and willing to, make those sacrifices. But a large part have not been. I know the Solicitor General said, we were hoping people are going to do the right thing, but they haven't been, or else we would see this. So, at this point, is that what you're relying on? Do you really think that this is going to make the difference? Or would you say, have you considered even a longer, stricter lockdown to be in place and stay that way instead of this open, close tug of war? Because there's suggestions that this open and close back and forth is only prolonging the pain of the pandemic and the threat to businesses.
You're prolonging it. You gotta burn it out. Yeah,
we did it before, and that's why
more concepts burned up by white people that tried to apply but in real life and they never worked.
The anxiety of people are frustrated. Everyone's frustrated. I get frustrated. Everyone gets frustrated. But you think of the frontline healthcare folks that have been doing this from day one. And we've all been working around the clock. But look at the frontline healthcare workers, and I just mentioned the teachers and everyone else that have been going at this nonstop. This is not the time to give up.
And they're convinced that they got God complexes because they think they know stuff. Not because they know stuff. They think they know stuff.
I want to paint a little bit of positive, because all we hear is negative. You go one side, it's wrong. You go to the other side, it's wrong. I always stick with health. But let's look at the positive side. We're hammering out, more than anyone in the country, more vaccines. And the next day or two will be over 3 million. The testing, I remember the testing when we first started. We weren't doing it. We're at 13 million. I don't even know anywhere in North America that does 13 million tests. The rapid test, we've deployed over 5.5 million rapid tests out there. Again, everyone is pitching in. So please, folks, let's stick together. We're at the end of this battle, and we just need to stick together and follow the rules. And that's it. We need to get vaccinated. Again, if you're over 60, please get your loved one vaccinated as soon as possible, and we'll be able to get through this. That's all we're asking. Again, we have a strong strategy, a strong plan of targeting neighborhoods, going into specific hotspot neighborhoods, and literally door knocking, trying to bring people out of their homes and down from their condos and their apartments. We have mobile units as we speak, going out there right now to get people vaccinated. We're going into
people with the bed bugs. So we go from apartment to apartment and check them all to make sure they got
manufacturing.
That's the level of genius. They hire an exterminator. They're not even sure is doing the work.
We will do it. We have the greatest.
Then they go from infested apartment to infested apartment, reinfesting.
Right here, that are busting their backs off.
And yes, they will crawl right up your shoe. You step on top of one, it'll fall right up in the
Why
crack.
don't we take a break in negativity for 3 or 4 weeks? And let's start being positive that we're gonna, we're Team Ontario. We will get through this, and we're gonna come out stronger than anyone ever. And then we'll kickstart the economy, and we'll leave everyone in the dust when we start kickstarting the economy. Trust me, we will recover.
He's from right.
So thank you, everyone, and God bless
Trust
you.
me, dog.
Thanks, everyone.
We have breaking news from the Ford government, which has announced a stay-at-home order almost a week after it was first suggested by health experts as the best way to curb the spread of COVID variants. Premier Ford also announcing changes to the vaccine rollout to get to more residents and education workers in COVID hotspots. We'll have more on that in just a moment.
And we're standing by to hear from the Education Minister. We'll be carrying that here live, but we begin our coverage with 680's Richard Southern and the latest from the Premier. Richard.
Well, certainly, James, a day here that will go down in Ontario history. You just heard it live on 680 News. Premier Ford confirming that the third emergency declaration of this pandemic will go into place at midnight tonight. A stay-at-home order will begin at midnight. The Premier says this is needed because things are getting out of control in hospitals. ICUs are at risk of being overwhelmed. The Premier begging Ontarians to, as he says, hunker down. Here's the Premier just moments ago.
Please stay home, because the situation is extremely serious, and we just need to hunker down right now. We need to limit mobility.
So here's what changes at midnight. Non-essential retail will close. It can only operate for curbside pickup and delivery only. Nothing changes, of course, for grocery stores and for pharmacies. They can continue to operate as normal. Something is changing for big box stores, though. They can only sell essential items. So what's essential in the big box stores? Groceries, household cleaning supplies, pharmacy items, personal care items, and pet supplies. All other aisles in your Walmarts and your Costco's, they will have to be roped off. The Premier facing tough questions here today about paid sick leave, but he is not budging
They're
on
open
that.
because they're
He said
essential.
there is a
Is every
federal
single
program in
item in
place.
Dollarama
Of course,
essential?
that federal
I'm just
program
wondering,
does
what's
take
your
weeks, in some cases, to get workers their money. The Premier also facing very tough questions
They're
here
a
this
small box
afternoon
store. They
about
sell
why
everything in a
he's
big
waited
box store.
to implement these new restrictions. It was, after all, 3 weeks ago that the third wave was declared. A week ago, the health cable was recommending these actions, but the Premier said he acted decisively as soon as he saw ICU capacity reach critical levels. All this information up on our website at 680news.com, and we're going to have full coverage this afternoon. Reporting live, Richard Southern, 680 News.
Premier Ford has also announced changes to the vaccine rollout to include all adults 18 and up in COVID hotspots. 680's Moment Crushy joins us live with those details. Moment.
So, Jenna, some significant changes to the way the vaccine rollout is being done in the province, announced by the Premier in just the last little while, saying that something people have been calling for is about to happen.
So beginning next week, workers who support students with special education needs across Ontario, as well as all education workers in high-risk neighborhoods in Toronto and Peel, will be eligible for vaccines.
He says that's beginning next week, and then it'll follow with people who work in teachers who work in other regions like York, Halton, Durham, and those areas as vaccine supply becomes available, although he didn't put a timeline on that. Also announcing that people living in areas with the highest rates of transmission will be prioritized with the vaccine through mobile units and pop-up clinics. That includes anybody 18 years of age and older. Again, not specifying exactly where those areas are, though that will likely have to come from the municipalities itself, but the province shifting gears with the vaccine rollout, trying to hit some of those hotspot areas, as well as trying to get teachers and educators their vaccines beginning next week. Reporting live, I'm Oman Qureshi.
Thanks for continuing to make us Toronto's #1 for breaking news, traffic, and weather.
On your radio, online, and on your smart speaker.
This is 680 News. Cleanliness and safety are essential to the success of any business. That's why Cintas has introduced our Total Clean program, a one-of-a-kind service that includes scheduled deliveries of essential cleaning supplies, hygienically cleaned uniforms, and on-site sanitizer and disinfectant services to help eliminate germs. Learn what the Cintas Total Clean program can do for you.
really hyper-focused on areas where there are hotspots, outbreaks, teachers, and so on and so forth. Visiting with mobile units, expanding the network for distribution, pending, of course, the requisite supply of vaccines and supports for people who may be sick at work. Doug Ford got pretty testy about that. He was exercised in explaining that the feds have put up the money and not enough people subscribing to it. So we'll get around to your thoughts in the immediate aftermath and reaction to what we heard from Ford and company on this third state of emergency for the province.
Visit newborrow.com. License 13115.
Did you miss filing your taxes? Did you let 1 year turn into many? Boxes of paper, lost documents,
I just want to know the number.
disorganized, confused, don't know where to start, what to do next? We do. Call Mark Feldstein Chartered Professional Accountants. We deal with this every day. It's never too late. Start sleeping at night. Call Mark Feldstein Chartered Professional Accountants now or visit markfeldstein.ca. markfeldstein.ca.
680 News Time, 341.
Traffic and weather together on the ones. Here's Carrie from Skis. This report is brought to you by Pizza Pizza. Northbound on the Don Valley Parkway, we have a problem approaching York Mills on the right shoulder. It's jammed on the northbound DVP from approaching Dundas all the way up to York Mills. Now keep in mind if you're planning to take the northbound